there was nothing in the literature that was evidence-based to guide surgeons in terms of how many opioids to prescribe after patients had been admitted and stayed in the hospital for a while after a major general surgical operation. So we figured, well, this is something that this is important, and we need to get some data on this so that we can practice evidence-based medicine. There had been guidelines by many states, in fact, to just prescribe a 7-day supply. But that guideline is pretty ambiguous because a 7-day supply could be 1 pill every 6 hours while awake, which is 3 pills a day, and that's 21 pills. Or it could be 2 pills every 4 hours round the clock, which would be 84 pills. And so there's a lot of ambiguity in exactly how many opioids to write for if you're just doing a 7-day supply. So we wanted to really understand better how many opioid pills we should send people home on. And again, we just tried to figure out, okay, how many the patients use. So we studied about 333 patients who had 6 major general surgical operations. These included operations, bariatric surgeries, other operations on the stomach, operations on the liver, on the pancreas, on the large intestine, and major abdominal hernia surgeries. So those are the operations that we looked at. And again, we just saw how many patients were prescribed when they went home, and then we contacted the patients, and we were able to actually contact 90% of the patients that we were studying, and found out how many opioids they used. And one of our hypotheses going in was that one of the best predictors of how many opioids people would be using at home was the number that they used the day before they were discharged. This, I don't think, would come as a surprise to any practicing surgeon. It just makes intrinsic sense. If someone isn't on any opioids the day before they're going home, well then, probably won't need any when they're going home. But no one had documented this, and this is what we in fact found, is that we looked at several different potential predictors of how many opioids people would use when they went home. And these varied for the patient's age and gender and how long they've been in the hospital. We looked at multiple different factors. And when you're looking at all these factors, the number of opioid pills they took the day before they went home was the strongest predictor of how many opioids patients actually used once they were home. So both in univariate and then in multivariate analysis, that was the strongest predictor. So that if patients, we were able to come up with a guideline. And so we then said, okay, if patients didn't take any opioids the day they went home, well, in fact, 85% of the patients didn't need any opioids after they were discharged. If patients took 1 to 3 pills the day before they were discharged, well, 15 pills would take care of 85% of the patient's opioid needs. And then if people took 4 or more pills the day before they were discharged, 30 pills as a discharge prescription took care of 85% of the patient's opioid needs at home. Before now, there was really no evidence-based guidelines as to how many opioids to prescribe people who had been inpatients after these major surgical operations and were being discharged. And now, based on seeing how many pills the patients need to use at home, we've come up with a guideline that's very simple. It's easy to remember, and the data is easily derived from the electronic medical record to figure out just how many pills they took the day before they were discharged. The beautiful thing about it is that it can be applied to any of the general surgical operations that we studied. So this applied to all 6 operations. So you didn't even have to know what operation they had. All you had to do was see, okay, how many pills they take the day before they were discharged.